So let's talk about tretinoin gel or tretinoin cream. Tretinoin is used to take care of acne. It is used to treat acne generally. However, we have some that are used to treat stretch marks and wrinkles. They are for anti-aging. Now we have side effects that is attached to this product. It is a medical formulation. Tretinoin is a drug under medical um, awareness. So you can't just take Tretinol because you have acne. You are supposed to take it with doctor's prescription. You are supposed to take it with doctor's advice. You are supposed to see your doctor and they will prescribe the particular Tretinol that you are supposed to take. Let's say you don't have the opportunity of seeing a doctor. You can always talk to people who know about it very well. But the idea here is don't go and take Tretinoin or use Tretinoin gel or cream when you don't know anything about it. So for you to understand this product very well, please listen to this video so that you can learn more. So I'll be talking to you about the types we have, the dosage. I'll talk to you about the precaution. I'll talk to you about how to use it. Then I'll talk to you about the side effects first before how to use it, because you need to know the side effect before you decide if you will use it or not. So we have 5 types of tretinoin. The first one is Altreno. Then you have Refisa, Retiva, Renova, and Retin-A. Retin-A, Altreno, Refisa, Retiva, Renova, and Retin-A, which is the general tretinoin we know. Most of the tretinoin you see around us, you see Retin-A on it. So that's the most common one in skincare industry. So what are their dosages? Tretinoin comes in the lowest 0.25%, then you have 0.05%, then you have 0.1%, which is the highest. So you don't just go for the highest. You need to start from a mild one, the mild dosage, then you graduate to moderate, you graduate to the highest depending on your acne condition, depending on how tense your acne is or what you want to use it for is. So, but the best bet is before you use tretinoin, make sure you are under the guidance of someone who knows about this thing, under the guidance of your doctor, the guidance of your medical practitioner. Having said this, the precautions for you to use tretinoin. You don't take tretinoin if you have dry skin. If you are among those people who have a dry skin, please don't use tretinoin, and I will tell you the reason. If you have combination skin, be sure that your combination skin is combinating or is combining, rather. Combining in the sense that it is a combination of oily and dry skin. But don't go and use tretinoin when you have a combination of sensitive and dry skin. That is very deadly with tretinoin. If your skin is sensitive and it is dry at the same time, in fact, for the fact that your skin is dry, it is sensitive. So don't use tretinoin. Why should you not use tretinoin if your skin is sensitive or if your skin is dry especially? It is because tretinoin takes care of your acne by sucking up the excess oil from your face. So it's more suitable for people with oily face, not just oily face, excessive oily face, because oil on your face is normal. It helps to cushion your face, it helps to grease your face, it helps to keep your face moist. So if you suck up the whole oil from your face, you have breakouts because you have more production of sebum, and some will be stocked inside your skin pores. That will cause you breakouts, which is acne or pimple, or acne and pimple at the same time. So tretinoin gel or tretinoin cream helps to suck up the excess oil from your face, thereby normalizing the amount of oil that you should have on your face. So if you have a dry skin and you are using tretinoin gel or tretinoin cream, you are going to over suck up the oil on your face that you will not even have enough oil on your face. Your face will dry up, your face will be wrinkled, you will break out excuse me, more than the number of acne you have initially. So it is not good for a dry skin. Then part of the precautions, do not use tretinoin while you are using alcohol. If you are using any cleanser containing alcohol, don't use tretinoin. Don't use any product with peppermint in it while you are using tretinoin. Don't use anything with that contains acid, salicylic acid, hyaluronic acid. No, don't use it while you are using tretinoin. There are tretinoins that contains hyaluronic acid because they have measured the amount of hyaluronic acid that can go with that tretinoin. But you using a product with hyaluronic acid and you want to use tretinoin, you know very well that hyaluronic acid also helps to reduce the amount of oil from your face. It works on your acne. So it's like bombarding your face with too many products that you know or you don't even know would spoil your face. So don't use tretinoin with acne with any product with acid, even if that product is vitamin C. Vitamin C is also ascorbic acid. So you need to use this thing under supervision. That's why I said you must use it under supervision. Also, you don't use tretinoin with any product that you know hurts your face or is too harsh on your face. Any face cream, any cleanser that is harsh, don't use tretinoin with it. Your face cream, your face moisturizer must be the one that is very, very mild, very, very mild, so that it can keep your face moistured after tretinoin has done its work or while tretinoin is doing its work. Also, your bathing soap for your general body, because of course it's going to touch your face, should not be a bathing soap that is harsh. It must be mild. So whatever you are using along with tretinoin must be mild. These are one part of the precautions that you take with tretinoin. Also, don't apply tretinoin on a wet face. In fact, if you want to apply tretinoin on your face now, you will have to wash your face 30 minutes ago, then allow it to dry between 20 and 30 minutes. Wait very well, make sure there is no moisture on your face. Then you apply tretinoin on your face, because tretinoin will react with water and cause your face to burn. So you don't use it that way. Before you use tretinoin at all, wash your hands, because your nails can contain microorganisms or moisture. So wash your hands very well. Then apply tretinoin when your face is dry. Another thing you need not to do when you're applying tretinoin, don't apply tretinoin and go under the sun. Tretinoin is meant to be applied on the face last thing when you are going to bed at night. As well as you applying tretinoin on your face, make sure that you are applying just a little quantity, just a tip of your finger, like the size of a pea, beans in other words, like the size of a pea. So that tiny quantity you have can go around your face, and you have to just put a thin layer on your face, not you know um putting too much product on your face like the way we wear our vitamin C serum, our face cream. No, not so. This time you just need a thin layer of tretinoin on your face to get a good result. Then the side effects you should expect. The side effects are that tretinoin might burn your skin. It might give you cracks on your face, itching. And is it tingling now? Yes, tingling sensation, burning sensation. It can keep your face warm. You'll be feeling hot on your face. That is what tretinoin can do. Tretinoin can give you hyperpigmentation on its own. It's not can, it will work in your face for the first 1 week. Then later it will start to work. How long does it take for you to see results from tretinoin? It takes 16 weeks, between 16 weeks and 12 weeks. That's between 12 and 16 weeks, between 3 months and 4 months. That's when you start to see results. Now, how do you layer tretinoin on your face? I've told you what and what you should do before applying tretinoin on your face. How to layer tretinoin on your face. Make sure you apply it on a clean, dry face. Then with a tip of your finger, you collect little from the tube and you damp it around the affected area. Then you smear it there. Don't bother massaging it so you don't cause irritation on your face. Just smear it in there, making a thin layer on your face. Leave it there and go to bed at night. Then the next night you repeat it. Make sure you use this lotion over and over again to get results. In other words, make sure you are very, very consistent with it to get results. I hope I have been able to tell you everything I know about Tretinoin. Okay, personally, I've used it and I've seen the result, but it didn't go well with me. Tretinoin didn't go well with my face. And I had to stop it along the line because I couldn't wait for 3-4 months to get results and be going through that hotness. I could not go through that. So I had to stop it. So please, if you are using Tretinoin, make sure your cleanser, your face cleanser, your moisturizing lotion, your body soap, your face soap are all mild products, so you don't cause a tough reaction that can cause a blast on your face. So that is all I have to tell you about Tretinoin. Thank you so much for joining my video. Until I come your way again, I remain your girl, Titi Biz Beauty.